Good morning, guys. So CRNA guy here. Just wanted to talk about the post-epidural teaching that I do. So what do you want to tell a patient after you finish putting in an epidural? There's a handful of instructions that I give that I think are important. They're safety related in some cases, and they're also just a part of addressing some things that the patient may experience. And if I know they're going to experience those things ahead of time, most of the time, if I tell them they're going to experience it, it'll make it a less maybe alarming situation, or maybe alarming is even a strong term, but it'll at least make it less, like if their back is hurting afterwards, they may be more likely to view that in their brain as like a red flag. Oh, my back hurts. They did the epidural, now my back hurts. Whereas if I tell them it's absolutely normal for your back to be a little sore for a couple days, then that kind of mitigates their level of alarm related to what they're experiencing. So here's my handful of things that I say to every patient I do an epidural on. The nurses up in labor and delivery, they could probably repeat my spiel because I say the same exact thing every single time. The first thing I say is your legs may start to feel different now. They may start to feel any combination of warm, tingly, heavy. They could go totally numb. It could be one leg more than the other, or they may not feel any of those things. Any of that is normal after an epidural. And that's usually the first thing I say, because what did we just get done doing that we were looking for numbness and tingling in the legs and it was a bad thing? The test dose. So we just got done doing a test dose and we told them, if your legs suddenly get really warm and heavy at all or tingly, we need you to let us know. You shouldn't feel those things, but if you do, we need you to let us know. So now their legs start getting warm and tingly, and I've had patients occasionally before I started doing this, they would say, oh crap, my legs are starting to get warm and tingly, and I would have to say, no, actually that's normal now. Sorry, I didn't tell you. So I've started just making that a part of my initial teaching that I do afterwards. So that's the first thing. Legs may get warm, tingly, heavy. They could go totally numb. Could be one leg more than the other. And then I say, as far as your contractions are concerned, different people are affected by the epidural a couple of different ways. You may get to where you don't know you're having contractions at all, or you may have like a little bit of pressure, a little bit of tightening. So in other words, you know you're having the contractions, but they're not really painful. You just know they're there. Or you may even have like a little bit of pain, like a 1 or a 2 on a 1 to 10 pain scale. Any of those is considered a normal working epidural. But no matter how comfortable you get right now, later on, as the baby keeps moving down, starts pushing on some things down there, you're going to start to feel pressure again. You're going to start to feel some discomfort again. And that is totally normal. The epidural is not designed to take all that away. So I let them know that I want them to have a realistic expectation that no matter how comfortable they get now, the epidural, they're not going to have zero pain from here on out. Sometimes unless you provide that explanation, when people start getting uncomfortable at the end, that's when you start getting all kinds of phone calls because they think the epidural's not working. And really, it's not designed to do that work. Now, the nurses up on the floor are usually pretty good about explaining that stuff too, but not always. And it'll mean something coming from my mouth, the person who just put the epidural in, to say that and provide that expectation for them ahead of time. It'll save you a few phone calls, and it'll help them mentally prepare for the fact that they're going to start feeling those things again. I tell them you can't get out of bed after this. If you try to stand up at all, you'll fall down. So don't get up at all. At least with what we use at our facility. Off the top of my head, I'm not sure if there's other facilities that use different. I don't even know what it was. It was before my practice time. The quote unquote walking epidural. I'm not sure if they just gave narcotic. I'd have to read up on that a little bit. But as far as my facility. an epidural is something that you don't get out of bed with, or you will fall down. So I let them know, hey, don't try to get out of bed at all. Your nurse will check your bladder every couple hours with a catheter, which you won't really feel too much because of the epidural, but because their primary concern is, well, how am I going to go to the bathroom if I can't get up at all? So I address that. I say the number one complaint after an epidural is a little bit of a backache for a couple of days afterwards. There's actually a lot of reasons why your back is achy after you have a baby. Between, the baby not being there anymore, and I think a lot of times, the spine is kind of like, oh, I finally got some room again. So people, they get some changes, especially maybe in their lumbar spine that maybe cause a little bit of achiness. They've been laying in bed a lot, pushing, and the positions that the different positions they're in for things. And then of course, truly the epidural itself does cause a little bit of discomfort, especially if it was difficult, if it was more than one poke, if it was a lot of redirecting the needle, a lot of like needle passes through the tissue. But especially the ones where it's like straight in, they're probably not going to have as much discomfort. But I still let them know that a little discomfort is normal with the epidural. I think probably the last thing that I mentioned, and I don't always mention this, but a lot of times I'll say, you may get sleepy after this epidural kicks in and starts working. And that's not because the medicine itself really, it's just because it takes your pain away, it relaxes your body, and just however exhausted you are is how you're going to start feeling. And for a lot of people, a lot of women who've been in labor for any amount of time, or they were an induction that came in at 9 o'clock the night before and they were up all night, with just what it's like to be in a hospital at night, getting maybe some vital sign checks, or, if they were a cervidil, but they went really fast and they started Pitocin, or if they started Pitocin right off the bat. Those are people who've basically been up the whole night before, depending on, when you're getting called for the epidural. But basically, these patients may be very exhausted by the time that you're giving them an epidural, and really just not to mention just being 9 months pregnant half the time. When they've been carrying a baby this whole time, a lot of them are just done with it. They're ready to be done, so they're exhausted. So they may get really sleepy, almost like sedative level sleepy, like where their eyes are closing while this whole spiel that I'm talking about right now. I'll be giving this spiel to people, and they're basically like falling asleep while I'm talking to them. So it is very normal for them to get sleepy afterwards. And even if they're not getting sleepy, that's another thing I say, but that's actually one of the best things that you can do for yourself right now is get some sleep. If you have a bunch of noisy family members in here, if you've got, the whole immediate and extended family all here with you, you may want to kick some of them out so that you can get some sleep. And I'll tell them, let your nurse do it. Let your nurse kick everybody out. Your nurse doesn't have to eat Thanksgiving dinner with these people this year, so let your nurse kick everybody out for you. There may be one or two other things, but that's basically the teaching that you want to do for somebody after an epidural. All right. If you like the video, click the like button, click subscribe, tell your fellow SRNAs, CRNAs. I'll probably, get, if you have other CRNAs subscribe, I'll probably get 1 million comments on how everybody else does things, and maybe that'll be a good thing because you guys will hear how other people will do things too. But this is CRNA guy. Thanks.